Again, if you're joining us, we're here with Congressman Neil Abercrombie and Congresswoman Mazie Hirono here at AARP to talk about the health care legislation. We have another question on the line. Cody from Waianae.
If health care legislation is passed without a public option, do you believe that that will ultimately be a disservice to the people of the United States because it will take away, the political will to do anything without, bringing in a key part of cost control?
I agree with that statement. I think a public option is a very critical part of any health care reform. What's not happening in the healthcare system is any kind of competition or true choice. So I believe that a public option is one of the ways that we're going to inject competition, which should result in lower prices. But at the same time, we need to make a lot of other kinds of systemic changes to how we provide health care.
The question is a good one in the sense that you use the word disservice to the whole question of health care and/or insurance reform. We do not know as yet what form the public option proposal will take. It's a work in progress and it's evolving. So my answer would have to be, I can't tell you whether it would be a disservice yet if a bill passed other than, or was proposed to us other than public option per se, because we'd have to see what the content was in relation to the public option that we favor. Unless we put forward genuine competition to the private sector offerings, I don't believe that we're going to have anything in the way of sustainable health care, let alone insurance reform, take place. And I think it would have a demoralizing effect, as you indicated you thought might be the outcome. So I find it kind of interesting that the principal argument against having public option competition is that it might be better insurance than can be offered in the private sector. Well, if it's better insurance, then it ought to succeed. That's the whole idea. If a public option and public service go hand in hand, then that seems to me in the interests of the public as a whole.
Charles? No, Beverly. It's Beverly from Kailua.
The many seniors in Hawaii that belong to Medicare Advantage plans, such as HMSA 65C+, will we continue to have that plan since the new health plan has been objecting to Medicare Advantage?
There will definitely still be Medicare Advantage. As some of you may know, the AARP does sponsor an AARP branded Medicare Advantage plans, and we know that there are a lot of good plans. However, as the Congresswoman explained earlier, some of these plans are getting substantially higher payments than they should right now because current policy pays all these plans very huge excess payments, these bonus payments, regardless of whether or not they're doing a good job. So what we believe health reform legislation should do is bring those excess payments down so that we are not paying these private plans so much more than it costs to care for their members in the traditional Medicare program. That will still allow them to provide good coverage, but in order to get the extra bonus payments, we think they should have to demonstrate they're providing good quality care and service in order to get those excess payments. So what we want to do here at AARP is bring the base payment rate down so we're not giving them excess bonus payments regardless of whether or not they're doing a good job, and then provide bonus payments only to those plans that can demonstrate that they are doing a good job. And there are a lot of good Medicare Advantage plans who will be eligible for those bonus plans. Sounds like you've probably got a good one there that you're very happy with. It probably provides you with very good care and service. And if so, then it would be eligible for these bonus payments. That would allow it to continue providing very high levels of quality and service and coverage to you.
Yeah, the question is not Medicare Advantage as an idea. The question is whether or not some of these plans are gouging people with excess payments for the service. And so they are utilizing the customers that they have as a kind of bait for a system of gouging and excess payments that are not warranted. And that, from my point of view, moves into the abuse side, if not outright fraud. So that's what's being aimed at, not whether or not you're getting service from a particular health plan.
Dorothy from Eva Beach. Great. Could you ask your question, please?
Well, the question was same like that from Beverly, from Kailua. Like, you know, I have a good plan, and like I said, if it's down the line, it's the new bill is going to enhance it, then I have to agree with that.
Dorothy, that's a good point. You would be making up your own mind as to what is to your advantage in this instance. That's precisely the point. We'll see whether we can put something forward that you think is better for you, and if it isn't, then you won't be involved with it. The problem, though, no matter what, at this stage, though, is the plan that you presently have going to continue to be affordable, or will it continue to be available? Part of the difficulties we're facing right now is companies are finding themselves unable to meet the rising costs and are revising whether or not they can even offer the retirees that they promised insurance, the kind of insurance that they took when they retired, whether that can be sustained or not because of the rising costs. So it would be one thing if everything was going to be frozen in time or the status quo was able to be sustained with regard to costs. But what we've discovered is that the likelihood of a precipitous rise in costs, including drug prices, is so great that if we don't do something, even those who are currently satisfied may find themselves put outside their capacity to deal with it financially.
Dorothy, nobody wants to overpay for a service, so independent agencies have identified that in the Medicare Advantage program that the taxpayers are overpaying for these services. We're not talking about cutting the services, we're talking about eliminating the overpayments, and there's some $177 billion in overpayments that taxpayers could save from this program over 10 years.
Let's take this question from Suzanne.
My question is, how will reform impact the growing shortage of physicians, especially that we have outer island? In particular, the current reimbursements are low for Medicare and keep dropping, and so it's difficult to recruit young physicians out of school that have large loans to pay back. How do you see the reform impacting this problem that we have?
There's a lot of emphasis on prevention, and therefore we want to encourage more people to go into primary care as physicians. And the bill that we're talking about will reimburse primary care physicians to a greater extent. And then also there are some other bills that will provide loan forgiveness for people who go to medical school and specialize and work in the primary care field. Also, we need to encourage more utilization of nurse practitioners and other providers of primary care services.
This is an excellent observation and question about primary care physicians, and particularly rural. We don't often think of ourselves as a rural state, but that's in fact what we are. The districts that Mazie and I represent right now, in terms of rural and urban, are very, very interesting. Almost half the population of the state, or literally half the population of the state, lives on less than 2% of the land. It's just a portion of the leeward side of Oahu constitutes the first district, my district, and then all the rest of Oahu and all the neighbor islands constitute Mazie's district. So we are very acutely aware of the difficulty that the caller, I think it was Dorothy, was it? Dorothy, Suzanne, excuse me, Suzanne brought up. And we've been grappling with that. I think it's fair to say, Mazie, isn't it, that of all the things that we've discussed in the caucus, this dichotomy between rural and urban and how we make the payments to providers and whether we can get primary care physicians at the center, it probably has occupied more time and more discussion than anything else in the entire care bill. So you've put your finger on a key element here of what it will take, what we need to deal with, regardless of one's view about public options or any of the other variations that are out there.
Thank you.